just last week, the PTF chairman and secretary to the government of the Federation, Mr. Boss Mustapha, hinted that Nigeria was beginning to flatten the curve with regards to the COVID-19 pandemic. I mean, the question, sir, Prof, should we take this seriously? Have we succeeded in actually flattening the curve at this point in time, sir?
As a scientist, I cannot just concur with that statement for now, considering the fact that the amount of testing that we are doing is actually going down. And for you to make such statement, for it to be proven scientifically, you must ensure that there must be a rigorous or vigorous testing, and then the number of people that are being tested, you are now getting more negative before you can arrive at that. You know, the challenges we have actually in this country is actually about the testing centers. Up till now, if you look at our population, over 2 million, and the number of tests that we have conducted so far is actually very, very small. And so you cannot conclude on that. If you look at most of those states, most of our states now, they are not even doing any testing. And so if you are not doing testing, it will be difficult for you to actually arrive at those that are actually positive. And we, you know, as a professional body, we always advise government on how to go about it. We are still advocating that we still need more testing centers in Nigeria, and then we still need more people. Almost all our states now are in and do a test. You don't need to limit it to people that have contact, you know. And the good aspect too is that people are willing. You don't need to have any criteria. You can walk to a testing center, and then your swab should also be collected and you will be tested. Now, we also advise government too that apart from doing all this molecular diagnostic technique, which we have very few centers, we are advocating that there's a need for us to actually have what we call rapid diagnostic test kits, where, you know, even blood samples can just be collected and then the diagnosis can be made. But I must tell you too that the Medical Laboratory Science Council of Nigeria, which is an arm of the federal government of Nigeria, they have been trying to validate the test kit that has come into the country. But from the last report that the Minister of Health made public is that all the kits that have actually come into the country, none has been satisfied okay for the rapid diagnostic test kit. We had known that coronavirus has actually come to stay with us. And the best way we should do is to put machinery on ground so that we can now continue, you know, living with the virus, just like other viruses that we have around. And so the protocol too that has been released by the Presidential Task Force and also the NCDC for school to observe so that school can be reopening. We need to reopen our schools, reopen our businesses, because this coronavirus has come to stay with us. However, we must observe the non-pharmaceutical measures. For example, as it is now, everybody must wear his face mask. In fact, face mask and even the face shield too should be worn at all time. And we should also ensure that we wash our hands with soap in running water all the time, or if you have hand sanitizer, it has to be used too. And then the physical distance, okay? We have to also observe it. 2 meters distance, we have to also, you know, observe it. Now that our worship centers have been open, they have been open, but government has also given them certain conditions, certain rules, criteria for you to actually abide by it. This virus has come to stay with us. And it is our own personal responsibility to make sure that we observe all the precautionary measures so that we can avoid getting infected with this virus. And for those that are infected, we have treatment centers we advocate that they should go to those treatment centers so that they can be adequately treated. Because if you are not properly treated when you are infected, you pose a great danger to the general public. And we don't want this virus to continue to be affecting our economy, affecting our health, affecting our social well-being, and a lot of those things.
But
yes,
based on your analysis so far, it is so clear that we are not testing enough. What more needs to be done in order to be able to actually capture the reality of this virus and its spread in Nigeria at this point in time? What more should the government be prioritizing, especially with regards to concern that there is probably going to be a second wave of this virus?
Media, you should continue to be conscientizing, people on the need for us to know our COVID-19 status. Very, very important. And when this thing is not done, my dear brother, we are heading into, an area that is going to be devastating to the whole world. Let us see how we can increase our testing centers. Number two, we should continue with conscientizing people on the need to actually take this test. Because, gone are those days, some people have stigmatization of going to do tests. Then government we should continue to, import more kits and then continue the validation so that as soon as we are able to get, more testing, like for example, I said the rapid diagnostic test kit, if we are able to get more of them, that will be fine. And which means that we'll just go into not necessarily collecting nasal swab, nasopharyngeal swab. You can just, all that we are after is to be able to pick what we call antibodies, seroprevalence. That is what government should also do. It's also part of the research. Among our professionals, people should go into, for example, people that are infected want to know what is actually happening in their blood. Do they have antibodies against coronavirus in their blood? If they do, then that should be, do we have now a test kit that can be able to detect the antibodies in their blood? And once we do that, that would be verified. And do you know that the easiest way we can even determine whether we are actually making progress is if only we have gotten what we call the seroprevalent. How many people in Nigeria are actually infected? And then from time to time, we now try to look at what we have is just like a baseline. And then as time goes on, we screen people again. You keep on screening. And then you try to look at the number. Are we going down or we are going up? That is how you can now say scientifically that we are actually on top of the virus. But as it is now, because of lack of, many testing centers, and then if you look at even people are not even coming again to do the test. If you look at the results that is being released by NCDC, you discover that some state completely, there is no result for them, which means that testing has not been carried out in those places. And when testing is not done, you cannot determine the level of infection in those places. And so when you cannot determine, then you cannot be saying that we are above, we are on top of the situation.
Now, Prof, let me get this, especially break it down to the level which our viewers can actually understand. Lots of people are arguing that we are not seeing a flood of cases in hospital with regards to the COVID-19. There is no anecdotal evidence to suggest that the state hospitals, the urban health centers are being overrun with sick people. Does that support the hypothesis that Nigeria is witnessing a slower spread, sir? No.
You see, the thing is that if you look at it now, it's not all the patients that comes to the hospital. And as it is now, we are even at the phase of community transmission. And so it is also very, very important that we need to even go into the community and you don't wait until they come, but there should be, a plan, machinery on ground that you go into the people and even test them. We had also advocated that you can do what we call house-to-house testing. That is the only way we can be able to pick these viruses in our society. But by the time you stay in the hospital, and you remember that as it is now, people are even afraid coming to the hospital because they think that when they come to the hospital, they cannot be infected. And so the government should have machinery on ground. We need to have plan on ground that we go into the community, go into people's houses, and we test them. And that is how we can be able to pick the diseases, not in the hospital at all.
Why has the federal government not leveraged on the laboratories, especially in the country, in order to expand the testing capacity?
You see, my dear brother, the problem we have with government is that government don't adhere to professional advice. Because if they do, right from the onset of this coronavirus, when it was happening by the time it started in China and started spreading, my own professional body released a position paper to government that all international flights should have been stopped at that time. If government adhered to our advice, I don't think we would have even recorded a single case. But government keep on, they did not consider, they did not implement it. They wait until when we started recording some cases before they stop. Already at that time, the virus was already in the country. And so we advise that government should be able to respect professional bodies and whatever positioned professional bodies, because we serve as the advisory role. We advise government, do this based on our expertise, based on our experience, based on our training, and we know the implication, we know the epidemiology of this virus. And if only government adhere to our early advice, I don't think we would have been where we are today.
Now, are you in agreement with the gradual lifting of restriction, especially with religious bodies and schools at this point in time? I know this is really a tricky one because of the economic consequences of the ongoing restrictions. Do you agree that we are ripe enough to actually start lifting these restrictions, especially in regards to schools, opening up of schools, opening of religious center at this time?
Yeah, just like I had told you earlier, we have studied this virus and we know that this virus has come to stay with us. And the best way we can do is to actually open up, our schools. Our children has been at home for like 9 months now. And, so for how long can we continue like that? And then even churches, religious centers, even at home you can worship, but there's always advantage when you come together. But I am also of the opinion, I support the government by coming up with a timetable and also guideline for religious institution centers to be opened and also for schools to be opened. And I also want to advocate that whatever it will take government, let government go into agreement with ASU and ensure that all the demand of ASU, let them reach an appropriate, resolution with ASU so that our tertiary institutions, universities will be open. The most important thing is that we must change because this virus has taught us a lot of lessons. So we must definitely, whatever it is, we have to change the way we have been living. We have to change the way we have been going out. We have to change the way we have been taking lectures and so on. So the best way, because economy, by the time you close, you are staying at home. Look at our private school teachers. They have not been paid because the proprietors, they will not get money if the school is not in session. I pity them, honestly. So the best way is let us open this, but the opening, we must make sure that we follow government advice and also the guidelines so that we cannot avoid, reporting or transmitting this virus.
Now, earlier on, sir, you mentioned the fact that there is need for us to take social distancing, physical distancing, the use of face mask. It should not become a way of life, for Nigerians till a cure or medical solution is found to this pandemic. And this is my last question, sir. There are tons of efforts that is going on across the world in order to find both an effective treatment for this virus as well as a vaccine. Are any of these looking very encouraging to you, sir?
Yes, very well. I must tell you that I happen to be a member of Plateau State a member of Plateau State Research Committee on COVID-19 and other infectious diseases. And I must tell you that we are even at the what we call the clinical trial phase. And the result we have gotten, even from animal study, was quite encouraging. Simply means that we have, herbal formulation, preparation around us that can actually cure these viruses. And we have done what we call the safety, the stage 1, which we test the safety of our preparation. And it's actually very safe. It does not have any effect on anybody. So what we are even saying is that this virus has also taught us that, look, let's go into research. Look at the plants we have around us. They have medicinal value. And by the time we start doing that, honestly, I am telling you, it's just that we don't want to make noise about that. But very, very soon, after we finish all the stages that we're supposed to do ethically, we will now come up to the general public and announce to them that we have actually discovered a cure. And once that thing is done, my dear brother, that will be the end of this virus.